Assalamu alaikum, the communication day. The role, you are the senior house officer in the pulmonology clinic. Scenario, Mrs. Sophia Adam, 65 years, known case of asthma, admitted since 3 days as asthma exacerbation. Today she's fine and well. The consultant decided to discharge her home, sit with her daughter, Mrs. Julia, and address her concerns. Okay, Dr. Azar,
Yes, yes.
we'll start after a while. Okay, here you go.
Hello, my name is Dr. Azhar. I'm one of the senior house officer in the pulmonology clinic. Are you Mrs. Julia, daughter of Mrs. Sophia Adams, 65 years old?
Yes, doctor.
Today we are here to discuss the health issue of your mother. Is that okay with you?
Sure, doctor.
I have taken permission from your mother to discuss about your health. Can we proceed?
Yeah, doctor. I am here also for that, doctor.
Okay. Before I proceed, I just want to know how much do you know about the health issue of your mother? Can you tell me?
Yeah, doctor. What I know, my mother already known case of asthma, and she's suffering with this since long time. She's using inhalers, and sometimes on and off with the steroid. Sometimes also get admission to the hospital. The last admission 3 days back, she was unwell also, and she got her medication in the hospital. And I can see today she's fine, doctor.
Okay. Uh, okay, Mr. Julia. Now our consultant has decided that since your mother now she is okay, she has improved, and now our consultant has decided that she should be discharged. And before discharge, we will give you some management plan. Okay, can I ask you some question?
Yes, doctor. First of all, I should thank you, doctor, as a team and your consultant. I appreciate what you are doing, doctor, with my mom. What's your question, doctor?
Okay. Does your mother have any allergy?
Any what?
She, she is allergic to anything like pets, pollens, or house dust mite.
She doesn't have, doctor. She's living alone. She doesn't have any pet or birds or whatever, doctor.
Okay. Now she is compliant with her medicine or not?
Yeah, doctor. Up to my knowledge, doctor, I can tell that she's compliant. I am not living with her, doctor, but I always ask my mother, how is the medication? Are you taking it regularly? And she's saying, yes, everything is okay.
So, so that's why since your mother she doesn't have any allergy, and we have decided that we will monitor your mother. We will have a regular follow-up. Why? Because why she is having attacks of asthma, because she is a known case of asthma. Are you getting me?
Yes, doctor, I can follow, yes.
So what we will do, we will involve multidisciplinary teams, like we will involve the asthma educator nurse, and we will involve the pulmonologist, and we will prepare a plan, and that your mother will regularly, she will take medicines in the form of inhaler, and she will avoid all those things which will increase her problem.
Doctor, who's the pulmonologist? I can't understand, doctor. What you mean by that?
Sorry, pulmonologist means that we will involve the lung doctor who's a specialist in these diseases, and we will also involve the asthma educator nurse.
Okay,
They will
doctor.
explain.
That will be great, doctor.
Do you have any concern that we are going to discharge your mother?
No, doctor, please. I told you, doctor, whenever she is at home, she's coming back with another attack. Please, doctor, don't discharge her now. I want to be sure she's fine.
I can appreciate about your feeling about your mother, but the thing is, if she will stay in the hospital, there are many patients, and uh, she can have infections from some other patients. So it's better now she's okay. We will give you some prescriptions, some medication, so that she can use at home. But if you want that she will stay at hospital, it will not be helpful for her, and she will be more in trouble. She can get some other infections. Is that okay with you?
Doctor, you said you have a lot of patients. My mother is also patient, right? Why you want to share my mother and you keep other patients? My mother is patient as well. What is that, doctor? It's unfair.
I can understand your concern for your mother, but the thing is, now your mother is she is improving, and she can be managed at home. And if we will keep your mother in the hospital, there are more chances that she can get many infections, because here we have all types of patients. If your mother now your mother have to take medicines in the form of inhalers, and we will give you some leaflets, brochures, all the informations. How can you manage her at home? Is that okay with you?
What if she had this attack at home, doctor? What I do and what she does? This is the
Okay,
problem, doctor.
okay. If she has any attack at home, we have given you some inhaler in the inhaler. Uh, these inhaler may be blue inhaler. You can give it continuously, and we can also give you some other inhaler which will be brown. So you have to continuously use this inhaler, and you can bring your mother anytime to the hospital. We are at your service.
Yeah,
Is
doctor,
that
but
okay?
I told you, doctor, she's living alone, doctor. I living far away from here, and I am not sure if she will be fine alone, doctor.
I'm sorry for that. We can arrange as a social nurse. She can regularly visit your mother, so that she can help your mother in this regard. Is that fine for you?
Okay, doctor. So if you have the guarantee that you will arrange a nurse, she will visit my mother regularly, I will be thankful, doctor.
Okay, do you have any other concern?
But still, doctor, I want to be sure she's totally fine. And what if she had this attacks while the nurse is not with her? What will be the issue?
Okay, we can add, you see, we can arrange a red button alarm system. If your mother is alone and she have the attack, she can press this button. The system will be dispatched, and we will receive all the information. And through this, we can send our team immediately to your home, so that your mother can be managed at home. Now, how does it sound to you?
Yes, how great, doctor. Is it free service?
No, it is paid service. It is paid service. But if anyone who cannot pay, then we can take the help of.
2 minutes
Uh,
left.
if someone cannot pay, uh, then we can take the help of occupational health workers. They can arrange it for you. Is that okay?
It will be much great, doctor. Thank you for your help, doctor.
Okay. Do you have any other concern?
No, doctor. Since you are offering this service for my mother, it's okay. I can let
Your
her
mother.
go home. Yes.
Okay. Yeah. Your mother smoke.
I don't think so, doctor. She's ex-smoker.
Ex-smoker. She's taking alcohol.
I'm not sure, doctor, but up to my knowledge, she was drinking at the weekend only.
Okay, so it's better. Do you know how much she is taking?
I think it's only 1 to 2 bottle or less. It's not. drinking a lot, doctor. She's not heavily drinker.
It should be under the social limit. Do you need any help?
No, doctor. Thank you so much for your help and for your service to my mother. And what you offer to my mother is great, doctor.
Uh, we, uh, we, we will give you some leaflets, brochures, and website where all the information about SMA will be there. And if you have any query, I will also give you my personal contact number. If you want to have any query, you can contact me directly. And, I will be very happy if you will contact with me. Is that okay?
Okay. Thank you, doctor. Time is up. Yes. Well done, Dr. Azhar. Yeah.
I think I think I could not do, but you
No,
will give
no.
me explanation.
No, no, you did everything right and correct. Apart from social services, before offering her some family members to sit with her mother. This is the only point you can say before offering social worker or social nurses. She will visit her intermittently. If she can arrange a family member, it will be more helpful for her to stay with her. Still, she need a company. Okay. And the other
Yes,
things, yeah, you did it great regarding the triggers, the follow up, the care, and finally, the final solution, as you said, it will be red button alarm system. It's a paid service, and it will just, if you it could explain more, it will be better. That whenever your mother feel unwell, she just press the button, and it will dispatch the system to our ambulance, and they will arrange for her as emergency as possible or as fast as possible, and they will bring her the hospital. It's like that. But anyway, the clinical communication, the clinical judgment, the concern, the welfare, all will be satisfactory. Apart from also the jargon. You said pulmonology.
yes, yes.
Yeah, take care. You said it at the beginning and in the middle. Pulmonology clinic. So try to be simple as much as you can, like lung doctor. That's it. Okay. I think the scenario, you catch the point here. You know about the red button alarm system. I think some of doctors doesn't know about it. It's a system, paid one, paid system or paid service offered to the patient who's living alone, especially those the frail, and if no accompany with them. It's again paid service in UK, and just they can. It's connected to the ambulance direct. Whenever they will press, the ambulance will be alarmed immediately, and they will bring her according to the location and address to the
It's called.
nearest hospital. Yes, Doctor Sarah, you know this system. Go ahead.
No, I don't know. A first time I know it. What is the name of this service?
Red button alarm system.
Red button.
Red-
Okay. But I think for this scenario, he can arrange a package if she could not are not able. Her mother is living alone, so we can arrange a package of care even without asking about any relative. We will ask her. We can help you to arrange a package of care as your mother is living alone. So this can be done. And the other thing at the end, Dr. Azhar said, I will give you my personal contact. This is not allowed. We are not giving the patient
Yes.
any
Mm.
personal details or any personal number or any personal email. Usually, we are using the NHS email, so you shouldn't offer any details about yourself because this is not in the medical practice. Maybe in other country are doing that, but according to the UK, we are not offering any phone number. Even the patient asked about the personal phone number, we couldn't give it because this is not allowed. This is only my comment.
Thank you, sir, Dr. Sarah. Thank you very much.
Okay.
Yeah, thank you, Dr. Sarah. I think if you can ask also about this system there in UK, it's there. We know about it, and it's one of the solution whenever there is family troubled with a mother or living alone, no one with her. She barely live alone, and she cannot cope with her daily activity, or she can cope with her daily activity, but she cannot help herself whenever she has a critical situation. So this system will let her be safe, and she might go home safely. Okay. Yeah, I agree for the point of contact number. You can either offer the department or emergency, but contact number it's not preferred to mention. Okay. Any other comment or question? That
I
this
just
service free or not? Yeah, it's paid service, Dr. Roda. It's not free service under the insurance. Yes, go ahead.
Uh, can I, sorry, continue? I will speak after you.
Yeah, so sorry, I just wanted to add we can add the asthma action plan. It will allow the patient to know the serious symptoms earlier and to call earlier for help before they reach a bad situation. And I think it's also wise to mention the vaccinations, especially flu vaccine, so we can refer her to the clinic later on for vaccinations to avoid these triggers.
Yeah, good idea. You mean the influenza annual vaccine, right? Yeah,
Yes, as a
it
part
would
of
be
welfare for the patient. Yes.
yeah, it would be good idea. Yes. Thank you, Dr. Ayan. Yes, who was talking before you or
Yes,
with you?
Mustafa.
Yeah, Dr. Mustafa, go ahead. Yes, please.
I'm not familiar about that red button for the emergency for the competent patient. There is something like that, but it is only for the patient with dementia who so many patients with dementia, which is not so severe, they live on their own. So it is part of the memory and dementia management, and they have their assistive technology library. And part of it, there is a communication with companies. For example, this button, yes, if there is anything happen to the patient who has dementia or is not completely cognitively 100% well, it can alarm by itself, or the person can press that one. So the company will get the signal and they will contact the ambulance. But for patients with other diseases like asthma, like ischemic heart disease, like that, it is only they can call the emergency services and they can reach them. But there is nothing specific like that, up to my knowledge, in the UK and in Ireland.
Yeah, thank you for your comment, Dr. Mustafa. But it's the point is the emergency and critical time. Sometimes this frail patient doesn't have the power to call the ambulance, and this button will be very easy. Just press, and it will be dispatched immediately without any effort. Asthma
Yes,
exacerbation, if happened, it might be life-threatening, right?
I agree, but in the matter of fact, is that button of service available? Up to my knowledge, it is not available at all. There is nothing like that. So it is just only a clarification. Maybe I am not, but I will ask, even I will ask again later about that, if this is available for any person to have a specific alarm or communication system other than the emergency number. Only I know that for the dementia people, there is specific, after memory assessment and others, some of them live at home, so they have that one. But that service, I am not against the benefit of that service. Yes, definitely it will benefit, but not to give, for example, the examiner something he will surprise if it is not exist. That's what I mean.
Okay. Do you think the dementia people only can get benefit from this service? And
Yes,
do you think the dementic patient can go to this button and he will press it if he's dementic?
yes.
I
Okay, maybe I clarify that earlier. That's some of the patient, not all of the patient. You know that the definition of dementia, and here in this part of the world, many people with dementia, diagnosed with dementia and everything, they live on their own. They live alone, and they can manage some of the activity of daily living, as they have home help come once or twice per day, half an hour or 1 hour. So dementia by itself, it is not So with this patient, he can live alone. So for that reason, he can use the bottom. In severe dementia, okay, this here the nursing home and long-term care. This is for other people. I work myself in dementia clinic. I work in memory clinic, and we discharge many patients with diagnosis of dementia with the assistive technology. One of it is that the bottom you can press it, okay, and the company, it is not the ambulance service, it is not the authority here of health. No, it is a companies get the signal, and the company on behalf of the patient, okay, call the ambulance that we have a patient with 123, okay, in this place, okay. He pressed that one, so they will go, and many times they will go and they find nothing.
Okay, let's review the topic. Someone sent the website of this service, and we will update it.
Okay, thank you.
Thank you also for your comment, Dr. Mustafa. I'm not sure also if it can be meeting criteria for asthma or just other patient. Anyway, we will search about it.
ديت
Okay.
دكتور باسم ده
Yes,
هي
doctor.
سيرفيس كده بايد بس
Okay.
ال NHS لها سوشيال سيرفيسز ممكن بتوفر ان هي
In,
تدفع
in English, Dr. Ahmed, please. Yes, please.
تمام. This service is available in UK. It's paid service. Anyone can do it. Anyone can subscribe and pay subscription. If the patient need financial support, the NHS has a special office social support and they have budget to support this kind of services if need. After assessment is cases one by one, individualized approach. If the patient really need it and he cannot afford the payment, they will pay for him.
Yeah, I got it now. Okay, we will also double check the website, and I will see who's the indicated patient to be accepted for the service. However, since it's a paid one, so everyone can order it. It's paid, so why not? I will order for my grandfather, grandmother, my mother. I think so. Let's double check it again, respecting opinion from Dr. Mustafa and from you as well. Just the option, it will not harm, and it can help the patient to be safe at home, and the daughter will be sure that she's under care of this system and might need help anytime. She can do this by herself. No need to be accompanied by anyone. Okay, it's one of the option. You can offer it. I think so. The examiner will not mind about it. I think so. Let's read it again and we'll double check and I will update to the group. Okay. Thank you, Dr. Ahmed and Dr. Mustafa. Dr. Azhar sent the scenario to the group. Let's read. Any comment from others, please? Before moving to the next scenario. Okay, this is the scenario.
Dr. Basim, I have one question.
Yeah, sure.
When the surrogate raised the issue that if she develop any problem at home, and I think the doctor respond that we would provide her about inhalers, the blue inhaler and the pink inhaler. In such case, should I specify the specific treatment, or in this case should refer for case doctor or whatever doctor who is responsible for the treatment? As we know, the general role in communication, unless written clearly in the scenario, we don't treat and we don't diagnose.
Yes, good question. Thank you, doctor. I think the answer will be according to the scenario. Stick to the scenario. If they mention to you inhaler, mention to the inhaler. If they mention oral medication, mention the oral medication. If they didn't, don't mention. Unless the surrogate ask you, what medication you will put my mom on, or what I should take if I go home, or whatever the question. But if not mentioned, don't be volunteer to say we will give you a medication named 1, 2, 3, 4, 5, 6. No, patient will go home by on the same home medication. She had a trigger, and by this trigger, she admitted to the ward. And accordingly, if there is any change in the plan, it will be written definitely. You will add medication and you have to counsel about this medication. The hidden agenda here is not the medication or the controlled or whatsoever. No, it was about refusing discharge. This is the task of the scenario. How to convince till the extent of, okay, I can accept discharge my mom home. Okay, so this is the point. If they wrote for you medication, it will be another scenario. You will talk along the scenario about the medication prescribed, the side effect, the route, the frequency, the compliance, and the side effects, alarming, red flags, side and so on. Okay, you got it, I think.
Yes, yes, thank you.
Dr. Basu, you can read the scenario.
Yes, I can read. Mr. Shukoko, 19 years old, previously healthy, brought to the hospital by ambulance in seizure attack. He was a nightclub with his friends when collapsed suddenly after taking ecstasy. He was treated by a multidisciplinary team as and stabilized. Investigation, ECG, CT brain are normal. Sorry, it was noise around. Sorry. Okay. And CT brain EECG investigation are normal. He became fully conscious and oriented and ready for discharge. His mother, Mrs. Farida, who just arrived to the hospital, wants to meet the treating doctor. You got his permission to speak, her permission, or his permission to speak with his mother about his medical suitability for discharge. You are medical senior house officer on duty. Sit with Mrs. Farida and address her concern. So again, the same point of discharge. Good to put the same topic in the same session. Okay, we can start.
Yes, yes.
Okay, hello there. I'm Dr. Mukhtar, the doctor in the duty today. You must be Mrs. Farida.
Yes,
Yes, and you are the mother and next of kin for Mr. Shukoko.
yes,
He is 19 years old.
yes,
Okay, we are here to discuss about his health issue. Is that okay for you?
yes.
Okay. I got permission from your son, Mr. Shukoko, to talk about his condition, if you don't mind.
Okay, you can go ahead.
Yeah. So before going ahead, can you tell me what do you know about Mr. Shkoko condition so far?
I only know that last night my son was in the nightclub and suddenly his condition deteriorated and he was brought in your hospital. And I just want to know, I just came here and I want to know what happened to my child and why he was collapsed. Can you tell me, can you explain me what was the reason?
Yeah, I appreciate your worry, Mrs. Farida, and I'm here for that. Before going more, can you give me expectation, or do you know, or do you have any idea about what's ongoing?
I do not know because my son never collapsed before. At first time it happened. And I just want to know why he collapsed and will he be collapsed in future again?
I appreciate your concern again and your worry, Mrs. Farida. Actually, let me answer your questions one by one regarding the collapse. Yes, it happened as all of a sudden. Yesterday, he came to us as a collapsed one, and we did everything for him, all scans, all investigation, workup. And let me assure you that everything came as normal, or wasn't significant finding with it. Are you following me?
Yes, I'm with you. But
Yeah,
I'm worried. Why he was collapsed? What was the reason? And is he having epilepsy?
I appreciate your worry, Mrs. Farida again. Actually, what he has was type of
Hello.
yes, yeah. It was a seizure type of convulsion. It means that he had shakiness over his whole body, hands and legs. However, we give him the medication suitable for his condition, and we control this abnormal movement. And we did everything scans just to be sure nothing behind this seizure. And let me assure you again that everything was unremarkable, means nothing was showing any cause for his seizure in his brain. How
So
that sound for you?
you mean to say that he is having epilepsy?
I appreciate your worry again. It's not epilepsy, Mrs. Farida. Epilepsy disease in which the patient will have the seizure recurrent, and also it will come and go every now and then. But for your son, it's not. We didn't find any of these causes of his seizure. How does that sound for you?
Okay. So if it is not epilepsy, maybe he is having any cardiac problem. That's why he collapsed.
It wasn't a heart problem, Mrs. Farida. It just happened suddenly, and we screened every cause for that, and everything was, as I said to you, showing nothing.
I
Hopefully, it will not come back.
I heard a lot about your hospital, and I know that your staff is very good and very intelligent. You must tell me what was the reason why my son collapsed yesterday.
Yeah, I appreciate your worry again, Mrs. Farida. Actually, what kind of information I gave to you, is it fair enough to know what about his condition? I mean, your son condition. Uh, Apart from this, I cannot give you more details. I'm so sorry to say that. Yes, I appreciate your worry, your concerns, but it's our duty today and in this meeting to reassure you that Mr. Shukuku is fine and everything done for him in the best interest for his condition. And now he's ready to be discharged home with you. How that sound for you?
Uh, do you think if I will take him to the home, he will not have these attacks in future? Are you sure?
Uh, I appreciate your worry again, Mrs. Farida. No guarantee in the medicine. However, I can give you some leaflet and instructions, brochures about this condition and this seizure. Whenever happens again, I will let you know how to manage it and how to deal with it. How that sound for you?
It's okay. But I also heard from my friends that if anybody collapse, he may have some blood sugar problem. He may have some other reasons. Uh, so I'm not satisfied. I'm not satisfied. I'm very worried, very much worried. Why it happened to my son? Why not happened to to his other friends?
Yeah, I appreciate your worry again, Mrs. Farida. However, we check his blood sugar on arrival, and now everything again reassuring. That's why we decided to let him go home. And I will again let you know some instruction whenever happens at home. Please call us or call ambulance to bring him to us. One of these, uh, please don't let him stay alone in his room or to lock his door behind. And the second thing, please ask him not to lock the door of his bathroom, as well as for swimming. If he goes to swim or any hobbies, to have some accompany with him in order to pick up any change in his awareness or abnormal movement whenever happened. How's that sound for you?
It's okay, but the thing is, all the signs and symptoms you are telling me, because they are going towards the favor of epilepsy. Because one of my friend, he's having all these symptoms, and doctor advised her all these things. So I'm very much worried that maybe my son in future may have epilepsy.
I appreciate your worry again, Miss Farida, and again, I can reassure you it's not an epilepsy, and uh, I can also reassure you that it will not come back most of the patient. However, if you feel any change of his behavior or any change in his mentality or his behavior or change of the motor or change of his power of the muscles, let us know. Is that okay?
It's okay, but I think you people did not accurately follow my son, and you are just thinking that he collapsed without any reason. There must be some reason. I think you did not went to the root cause of the problem. So
Yeah.
this thing is worrisome for me.
Yeah, I appreciate again your worry, but what I told you is the maximum information I gave to you. Other than this, it will be confidential to Mr. Shokoko, and we are sticking to this confidentiality. I cannot tell more about what happened exactly. Can I
He
ask you some
cannot drive.
question?
Okay, okay.
Yeah,
So
what's his job?
no, he's a student.
Does he drive?
Yes.
Okay,
Can he continue to drive?
I appreciate your worry. However, we will update you again when he resume his driving. However, please, he can hold his driving for a while until be sure that this will not happen again. How does that sound for you?
It's okay. It's okay.
Okay, and does he smoke?
No, occasionally,
And does he drink alcohol?
sometimes,
Okay, let me
but
tell you that smoking and alcohol one of the triggers for this, and uh, I can highly recommend that he can stop all of this. Is that okay?
okay, it's okay.
You have any other concern?
No, time is up.
Okay, thank you. You can comment.
I think you did very well. You did very well. Only this was a point of confidentiality that you will not disclose of his drug abusing. You did not close. Even I asked you many questions. In spite of all these, you told that I have only permission to update about your condition. I don't have any permission to disclose his confidentiality. Only this was the case. Thank you very much. You did everything excellent, Masha.
Okay, thank you, Dr. Azhar. Thank you so much. Appreciate it. Any comment from others? Sorry for being noise around me today because I'm outside somewhere. I'm so sorry for this noise. Okay, any question or comment, Dr. Sarah? Yes.
I think only in this scenario, don't you can say yes, you won't breach the confidentiality. You couldn't say that, but you can make it in a way that it's not that you are hiding something from the patient. You will make it as clear. You will say, I think your son will be at the better position if you ask him this question, and stop. And then if she insists to know anything, here we are respecting patient confidentiality and like that. But at the beginning, say it's better to discuss it with your son. He might be at the better position to explain for you what's happening. If she said he's taking drugs or anything like that, so you will tell her only like this. And then if she insists, you will tell her about the confidentiality. Because this
Yesterday,
scenario.
Dr. Basu told,
Yeah.
Dr. Basu told that I have only permission about his health condition, but I don't have permissions about his drugs. So I cannot tell you anything about why it happened.
Yes, because she might know that it's the drug. Because this scenario was on past test, and the role player was saying, "I think that your son will be in better position to tell you if he's taking drug or not. So if you said I won't tell you, I respect confidentiality, so it means that he might be taking drug and you don't want to say it. So you'll say, discuss it with your son better. Don't like
But
this.
but if he raised or she raised it, but
He-
in this, yeah,
Yes, and
I,
if she insists to raise it, so you will tell her, we
yeah,
respect
if
patient
she,
confidentiality and we are not allowed to talk about anything else apart
yeah,
from discharge summary. He
yeah,
allowed us to that. So we are not, I don't have any permission to talk
yeah.
about like this.
If she asked particularly or specifically, does he take any drug, doctor? Please tell me. That
You will
time
make
I
it
will,
as general.
yeah,
So you will answer, I'm here to discuss with you. I took from
the
your son's
health issue.
permission
Yes,
the suitability for discharge and about his medical condition. So
yes,
your son will be at the better position to answer all the other questions
yes,
you might need to ask about
exactly. Yes,
like this. So you'll make it like this. So um, you won't be telling her frankly no. So she will think that it is yes. So you will tell her all these questions. You make it as all the questions that are in your mind. You can ask your son about it, but anything related to his health condition, I'm here to discuss it with you. So you
Very
will
yes,
nice.
answer as a general.
yes.
All
If
the
she,
all the general
yes,
questions that can run in your mind about your son, you can discuss it with him. He will be in better position
yes,
to answer you. But I'm here to discuss with you about only his medical condition, and I have permission from him for his medical condition. So now you make the confidentiality clear without. She asks you about specific question, but your answer will be a general question. This is my
yes,
meaning
yes,
of answering.
No, no, very nice. Dr. Sarah, very nice.
yes. Good, good,
I wrote this on test, so it was like
good option.
he,
Yeah,
he,
yeah, good
he
option.
asked
Yeah,
me
you
at
can say to your son, even you can kill him, but don't ask me. He will be in the better position to answer you.
yes
I
all
know,
other
I know,
questions.
I know Dr. Sarah, she loves doing cases of communication scenarios. I know.
Yeah,
And
she's
she,
expert. She's expert in the communication.
I
yeah,
feel
yeah,
in one.
she's
I feel
always
in one
having,
communication. I feel in one communication, but I think I start to improve myself to know.
Yeah, good. Yes, and you have also this topic in your clinic. You are talking about such sensitive topics,
Yes,
so
yes.
you know how to deal with these situations. Yes, good. Thank you, Dr. Sarah and Dr. Azhar as well. Any other comments? Yeah, Dr. Marwa said the mother didn't mention. Yeah, I agree. If she mentioned, yes, you can say like that. It's not our topic here. We are concerned about his medical condition. If you want to know more about this, or if you want to talk about this, your son will be in the better position to talk about the drugs or whatever. But we are here to talk about the medical condition. Yeah, if she insists to know the cause, yes, I agree. Yeah, thank you, Dr. Marwa. Any other comments?
Dr.
Any?
Qasim, you can
Yes.
just this chat,
Sorry.
you can read the chat.
Yeah, yeah, I
Chat
read. I
box.
read. Already Dr. Marwa wrote.
No, no,
Yeah.
there's one red bottom alarm someone has written.
Yes, I will update it in the WhatsApp group. I will find the indication for it button alarm system. You mean up? Okay, wait.
No, someone has written.
Okay, yes, yes. I just see it. Abdul Minam. Yes, yes, Dr. Abdul Minam. The red button service is not designed for all patients. It's specifically catered to individuals who are vulnerable and at higher risk of emergencies due to health of living condition. This includes elderly individuals living alone, yet is one the first, patient with dementia or other cognitive impairment, agree, people with disability or mobility issues, those with chronic illness or condition requiring urgent support, individuals recovering from surgeries or major health events. It's not universal service for all patients, but is tailored to those with a higher likelihood of needing emergency assistance. Yes, thank you, Dr. Anam.
I
Nice
think we
comment.
don't need to say about this because usually we are not talking about the paid service. We are in the NHS. So if the patient asks you about this, so we can say you can have it, but usually the NHS service, everything and the package of care is a free service. So I'm not quite sure if it's better not to talk about it
Yeah,
because
you
it
will not go
paid
deep,
something.
Dr.
Yeah.
Sarah. I agree. Will not go deep. It's offer. for those people. And our patient, one of these indication, I think, patient frail and living alone,
Yes, no,
we
the
can
patient
get
failed
benefit
and
from this.
living alone, we couldn't discharge this patient. We have one
Yeah.
patient that she was admitted, she was having kidney failure, polycystic kidney on renal dialysis. She has been discharged, and she when she came to dialysis, she's living alone. So we couldn't discharge her and kept her in the hospital. Still, will arrange a package of care for her. So any patient living alone and need some help, so we don't take the decision. Many patients staying in the hospital not for medical condition, only waiting for the package of care and to be allocated for social help. So this is we can offer it, and this is a good thing that we can
Yeah.
say. As your mother is living alone, so we can help you with that. We arrange a package of care for her. So this will be helpful for her. They can do two package of care. It's mean two people coming to see her in the day, maybe 4 times a day. So this is we can do that. But I think the paid one, no need to talk about it in the, because this is the paid thing. So we are doing commercial. So it's better not to talk about anything paid.
Okay, so package of care service.
Yes,
It will,
so
yeah,
we
it will be, yeah, it will be, yeah.
Yes, so we can say we'll arrange a package of care for your mother, so they can come to help her on a daily basis, maybe 3 times a day, 4 times a day, according to her needs. So I want you to be reassured about that. We'll discuss it with the social team here, and we'll arrange a package of care for your mother before she will be discharged.
Okay, it's a good idea, but it will not harm even to offer the other system, which is paid after that. If she refused, if she said to you, "How I leave her alone at home," because this nurse or the person who's going or coming to my mother, maybe after now and then for a long time, so we can offer. I think I agree for the red button alarm system anyway, even it's paid, but you can go step by step until reach to the level of this service.
As
Sorry, Dr. Sarah, it's breaking down your sound. Okay, any comment until Dr. Sarah will join back? Any other comment? Hello? Yes? Any question? Any comment? Any question? Please feel free to comment before ending the session. If no more question, we can end the session. Okay, I think all are satisfied. If no more question, we can end the session and wish you a nice weekend. We'll see you, inshallah, on Saturday with the clinical day. Have a nice weekend. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum assalam.